Rule number one, if your water breaks, you should come in as soon as that happens. It's usually not standing in a puddle. It sometimes can be a slow leak. So if you question that you're having leakage of fluids, come on in, let's rule it out. Second, your contractions. Painful, regular contractions are indications of labor. It's the 5-1-1 rule, so if your contractions are 5 minutes apart from the beginning of the contraction to the beginning of the next contraction, last longer than a minute, for more than an hour, that is your ticket to come in. Also painful, meaning that you are unable to walk or talk through them, you're breathing through those contractions. Third, if you have any bleeding, vaginal bleeding at all, that's another indication to come in. Can mean that you're in labor. It also can indicate that you're having a bloody show or dilating. Come to the emergency room entrance. Yes, it says emergency room across the top, but it is the entrance to the hospital side of the building. You will check in at the emergency room desk as well. From there, you will then be either taken back to OB if you're over 36 weeks pregnant, or ER if you're under 36 weeks pregnant. We will put you in a labor room. At that point, we will hook you up to the monitor, check out baby's heart rate, see how often you're contracting. At that point in time, we may check your cervix to see how far along you are, and then rule out any other high risk factors. At that point too, we'll call your doctor that you have been seeing throughout your pregnancy, let them know that you're here, what we're assessing, and then we'll take direction from there.
I think one of the joys is that the clinic and the hospital are completely connected. If you need a C-section emergently, we will get you back as quickly as possible. You walk down a hallway or we wheel you down the hallway. We can hook baby up to the monitor, get an ultrasound or whatever is needed. After baby is born, we try to get baby up on your chest as much as possible to get that skin to skin. And during that time, we are also listening to baby's heart and lungs to make sure baby's doing well. Once baby's had a long time for skin to skin, has had some time to nurse, if you plan to breastfeed, then we will often take baby to the warmer and I will do my full exam on baby, make sure I'm not concerned about anything, and we get a quick set of vitals to make sure that baby looks great, and then baby comes straight back to you. First, we will assess where you are in your lactation journey after baby is born. Would you like to breastfeed? Would you not like to breastfeed? And we 100% support you in your decision. And if you would like to breastfeed, we try to get baby latched within the first hour of life, really is our goal. And we work with you throughout your postpartum course in the hospital and outside of the hospital on lactation and making sure that you have the breastfeeding support that you need.
We do have 2 nurses that are going to be lactation certified and would love to help you and be a resource with you postpartum wise too. If you have any questions, complications, any worries, we would love to be on that end and help with that.
Usually for a vaginal delivery, it's 24 hours, and for a C-section is 48 to 72 hours that you stay in the hospital. But we make sure before we even consider discharging you or baby that certain milestones are met and that you both are doing really well.
We will go through education with you prior to discharge. You will have to get all your birth certificate stuff in order, get your application for your social security card for baby in order as well prior to leaving. We can help you book follow-up appointments. Usually you're seen 1 week after delivery, and then have well child appointments booked out as well as your 6-week postpartum.